Most of the time when you think of alcoholics, I would say liver disease, and I think heart disease and the complications of the heart are often left, unspoken about, and people don't understand the effects of alcohol on the heart as much. So when you use stimulants, cocaine, amphetamines, anything along those lines, you get this really big noradrenaline, norepinephrine surge in your body. So you get really high blood pressure, high heart rates.
She comes in and like half of her skull was cut out. So she was wearing this helmet, but that's what happened to her. She got so much bacteria from the well water in her system that like they even left her on opiates. And I was there 28 days in a detox, and she was still there when I left because they couldn't get this bacteria out.
Here we are, Real Recovery Talk. I am your host, Tom Conrad. In today's episode, we've got Benjamin B.
What's happening, everyone?
And we have Dr. T.
Hey.
First things first, thank you for tuning in on the podcast app, whichever one that you choose to use, and thank you for watching on YouTube. In the end, if you have any comments, questions, or concerns, you could always reach us, info@realrecoverytalk.com. Again, it's info@realrecoverytalk.com. And ultimately, we want to help you turn your mess into your message, right, Ben?
That is a fact, Tom.
Right, T?
That's right.
Okay, here we are. So we're going to start titling these episodes The Doctor's Opinion. You like what I did there, Ben?
I like it.
You know where I got that from?
It's a reference to the big book of Alcoholics Anonymous.
Yeah, so I think there's kind of a cool little ring to it, like The Doctor's Opinion with Dr. T.
I appreciate that.
Yeah.
Let's give credit to Charmaine, too.
Yeah, Charmaine.
Charmaine is our newest member on the rock team.
Yep.
He was a client of ours how many years ago?
Probably
over 5
almost
years ago.
No, he just celebrated 4 years.
He had a minor relapse after us, though.
Oh.
We should bring him on to tell his story.
Throw that out
That
there.
would be great.
No, we should have him come tell his story because, yeah, he's got a heck of a story, too.
Okay.
Yeah, but he just started with us a couple months ago. He has 4 years of sobriety, but knows the program in and out because he went through it.
Yeah, he's a tech of ours. Killing it.
He was a house manager, too, for a while.
Mm-hmm. He sure was. Shout out, Charmaine. You're going to come on the podcast, and I told him no royalties, though, on the doctor's opinion thing.
Okay.
He was cool with that. So, but in today's episode, we wanted to discuss, because I believe it's, what is it, Happy Heart Month or something?
Heart Health Month.
Heart Health Month, Ben.
I better check into my cardiologist there, Tom.
That's right. So we wanted to talk about, in particular, the heart and the effects that substance use can have on your cardiovascular system. And this is kind of a little bit of uncharted territory for us. You okay, Ben?
Yeah, I'm just the LaCroix burps. Sorry.
Okay. All right.
I didn't know if you could hear that.
No, I can't, but I can see it.
Okay. I'm good.
Looks like you might be having a heart attack.
Possibly.
We wanted to bring this up. Like I was saying, this is somewhat uncharted territory for us because we don't really talk about medical issues all that often. But now that we have the doctor, we can get the doctor's opinion on this. And, people can come to realization about the risks that they're taking on their heart, when it comes to substance use. So basically what we did is we kind of listed out all the main substances that get abused, and we're going to riff on some of the effects that it can have on your heart. Mm-hmm. How's that sound, T?
I love it.
All right. So the first one being alcohol. For all my fellow alcoholics out there, this is, and I'm not a doctor, so this is my opinion. I think that when it comes to organs and alcohol, the heart is going to be the one most directly affected. Would that be an accurate statement?
I think the liver comes very close to that. Maybe the liver. I mean, you see equal complications of both, but it would be.
Which one is going to have the most, how would I put this? Like when somebody dies, mortal? No.
Fatal.
Like morbidity and mortality
yes.
is what we talk about. Usually, again, you usually see liver issues because alcohol can induce a lot of things on the liver acutely and then chronically over time. alcohol, I mean, obviously the heart as well. But most of the time when you think of alcoholics, I would say liver disease. And I think heart disease and the complications of the heart are often left, unspoken about. And people don't understand the effects of alcohol on the heart as much.
Is that maybe because, and I'm just guessing here, is that maybe because, like with the liver, your window of time maybe to live is longer? Like you damage your liver, I feel like you could go longer, where with your heart, you got heart damage, you'll just be like here 1 second, gone the next.
Both of them, both of them are the effects that alcohol has on both organ systems. It's like a chronic usage over a period of time. There are instances where there is an acute issue with liver, like alcoholic hepatitis, that can kill you, acutely. Same thing with the heart. You usually hear the term, I don't know if you guys have heard of holiday heart syndrome.
No.
So holiday heart syndrome textbook, we usually see it in the hospital with someone. It happens in young kids, even when they're binge drinking. Tons of alcohol over a short period, maybe 1 to 2 days or one night, but significant amounts of alcohol. And they show up to the ER because they say, I feel like my heart's fluttering, they're flushed, they're short of breath, they're having chest pain. They don't know what's going on. They think it's a panic attack. And what happened is that alcohol gave them a huge sympathetic nervous system adrenaline surge and put them into atrial fibrillation. And usually in the younger patients, you can either give them a pill, like an antiarrhythmic, or sometimes they have to be shocked back into like normal rhythm because they're so unstable at that moment in time.
Is that permanent if that happens, or the pill reverses it?
The pill will reverse it, and the shock, like the cardioelectric shock to them, will reverse it back to what we call like normal sinus rhythm. But like my cousin, for instance, he had to be shocked, I think like 3 or 4 times, over a period of years. From
alcohol?
From alcohol.
Oh.
And so it's like, hey, it's not normal to have to go to the hospital at that age and then 2, to be shocked more than one time, leads into the conversation as, hey, what decisions are we making? This is now taking effect on your physical health. What are we doing?
What is, I've heard congestive heart failure. Mm-hmm. What is that exactly? And how can alcohol cause that?
So congestive heart failure, it's a broad term. Your heart is a muscle, right? And you have 4 chambers. And the main chamber we talk about is your left ventricle of the heart. And that's the one that pumps blood to your aorta, which goes into your entire circulation. So what alcohol does over time, I think we talked about this before. What did we say? 80 to 90 grams a day over a period of 5 years could lead to what we call dilated cardiomyopathy and heart failure. And the reason it causes that is essentially the muscle goes from being this strong, sponge-like structure, and it just totally thins out and it loses its architecture. Mm. And then what happens is it's like losing muscle. Like if you get deconditioned or are not working out, your muscle atrophies, and then your heart can't pump to the rest of your body. And when the heart can't pump to the rest of the body, what happens? Blood backflows from your heart into your lungs, your liver, your legs. So those patients get, shortness of breath. When they're walking, they can't lie flat. They build up fluid on their legs, their lungs, and then they have to be admitted into the hospital for diuretics to get the fluid off of them. And over time, if you don't stop drinking, that can be a chronic thing.
So when you see people's legs that are swollen and stuff like that, like with alcoholics, I've seen that. Is that a result of that? Or that's water retention?
It could be related. Maybe they have liver disease because your heart, when blood backflows from your heart into your liver gets congested, right? And liver congestion over time also, then, fluid accumulates in their legs. So it could be from that. It could be from venous insufficiency. But, a typical patient with what we call alcoholic cardiomyopathy, usually, they're usually obese. They do have like swollen legs, but they usually complain like progressively and slowly. Like they lose their tolerance, exercise tolerance. Like, so from going to the chair to the bathroom, they're like, I can't even catch my breath doing that. Or I can't lay flat in bed at night. I have to lay propped up. And the reason they have to lay propped up is because when they're flat, the fluid surrounds their lungs. So in order to catch their breath, they have to sit up. So over time,
brutal. Is that reversible?
So what we educate people on is initially, it is reversible, but there's no medication that's going to fix it. It's going to be abstinence. You have to abstain from alcohol because it's breakdown products as well as the effects that it has. We call it the renin-angiotensin system, which is related to your kidneys, liver, and fluid balance in kidneys and heart and the fluid balance in your body. It gets upregulated. So over time, the only way to calm that down or to stop that is to stop drinking. So people sometimes they'll stop drinking, maybe for 6 months. They'll get a little better, not much better. They relapse, they get worse. It's not until they fully abstain that they can regain a little bit of function. But if it's a chronic process, relapse over time, it can be permanent.
Right. I remember we had a client here a while back that came in with congestive heart failure. I can't say his name, obviously, but that would have been probably 5 or 6 years ago. And he's doing good now. He's sober, has a job and everything. He was actually on disability for congestive heart failure. Ben, you would know as soon as I say his name, but obviously can't right now.
Yeah, I can't think. I'm thinking of an older gentleman that we had. That was congestive heart failure as well.
You have the big book in your hand.
I do. I got a question before I get to that part, though. So I kind of just want to point out, like, a lot of the times I feel like, all right, I'll put it when I'm in my shoes. I'm in my shoes all the time. As an alcoholic and drug addict, like, you tell me all the things that could happen to me, and I'm like, not that I don't think it won't happen, but it's not a priority to be like, oh, I could get heart failure or liver disease or whatever the case may be. But I kind of want to point out that, Dr. T works with us at a PHP, IOP level of care, but also works in the hospital and at detox level of care. So, like, you see this stuff. Mm-hmm. And correct me if I'm wrong, we've seen it. Like, we see quite a few cases of even people below the age of 30 with liver disease, heart failure, all kinds of stuff going on. Like, we tend to think that you're just trying to scare us. Some of these kids, like, I've seen kids in their early 20s come in with significant liver damage and congestive heart failure. And it's like, it's really happening. I don't want to and that changes that person's life forever. It's no small consequence.
Well, we had the one gentleman just pass away, and we don't know, we know it was from alcohol. Mm-hmm. Now, did he asphyxiate or did he have a heart attack or what? I don't know the answer to that, but he was a 34 year old young guy and, died in his house recently from alcohol.
Question for you too, being that you're in a detox setting often with the liver stuff. Like, I know you go to detox, you get blood labs done, you get your labs done, to check your liver. Usually you have heightened liver enzymes. You're like, oh, we should check this out. When it comes to heart stuff, is it usually because of an event, or does labs show that, or like what happens there? How do we find out?
So usually labs, there's not really anything you can do to check on labs. most of the time, the precipitating event is that primary care doctors, right? If you have a good rapport with your doctor and you start having these chronic medical issues, you'll be referred to a cardiologist, and you have a good rapport with your primary care. So they should talk to you about it and let you know, hey, a lot of these things that are coming up, the high blood pressure, the weight gain, maybe you're retaining fluid, that it could potentially be because of your chronic use of alcohol, even if you don't think it is a lot, right? Or maybe you've just been drinking, like we said, so much over a long period of time that now it's starting to have chronic consequences. But usually these people we see them in the hospital if you don't see them in like the primary care setting. And when they get to the hospital, usually it's at that point where their heart's failing or they're in fluid atrial fibrillation and something's happening that they need acute care. But in the like detox, the outpatient setting, lab wise, no, usually it's more of I'll ask them, what medical consequences have you had to your use, no matter what substance it is? Like, how many hospitalizations? Have you ever been to the ER? If so, for what reason? Have you had the chest pain, the shortness of breath, weight gain, lower extremity swelling? You just go through a whole gamut of questions. And if they do screen positive when I'm talking to them, then that's when we'll go into a more in-depth talk about, all right, here's the next steps. This is what we need to do for you concurrently with your substance use treatment.
Gotcha.
Interesting. What were you going to refer to?
Well, there's a line in the big book, I can't help myself, that says, and this is in Bill's story, my weary and despairing wife was informed it would all end with heart failure during delirium tremens, or I would develop a wet brain perhaps within a year. I think, too, just the strain that alcohol, like if someone drinks to the point where they have the DTs, like just that alone, maybe you don't even need a precondition. And it's like, it's just so hard on your heart detoxing that people just have a heart attack and keel over. Is that the case?
Usually they'll have pre-existing heart disease that they don't know about. Because for the type of heart failure, when we talk about alcohol, it's like the second leading cause of cardiomyopathy. Obviously, ischemic cardiomyopathy is number one in the United States.
What's ischemic mean?
Ischemic means like atherosclerotic disease.
Like arteries clogged. Mm-hmm. Okay.
But for dilated cardiomyopathy, it's, they say 1/3 to 1/2 of all cases are usually from alcohol.
Oh, wow.
Rather than other things.
Really?
So if they do have something, could it purely be due to alcohol? Yes, but there's a lot of other comorbid things that come along with it. But alcohol itself can lead to high blood pressure. It could lead you to have increased risk of like triglycerides, which put you at risk for heart disease. The atrial fibrillation in itself makes you at risk for stroke. So there's a lot of factors that play into it.
Yeah, I imagine too, if you're an alcoholic, either you're eating nothing or you're living off of like cheeseburgers and pizza and wings from your local bar. Mm-hmm. Can't be good for you. That you, Tom?
That was me.
Tom put his hand up.
Hot cheese balls and chicken wings.
Tater tots, cheese curds.
No tater tots. No, I like the fried mushrooms.
Okay.
I had a lot of those.
Like those.
Yeah,
Fried
except
pickles.
when you would bite into them, like overly drunk and just wanting to eat something, and then you bite into a hot fried mushroom, and it like squirts and burns you because it's like a gajillion degrees. Yeah, that's not good.
Nothing another drink couldn't fix, right, Tom?
That's right. Yeah. All right, so let's move on to the next one, cocaine. Cocaine's interesting because you hear a lot of times people with cocaine, addicted to cocaine, heart attacks. I mean, that's what as a matter of fact, somebody that I know of, a wife of my wife's friend's husband's brother. My wife's friend's husband's brother just died, 43 years old, from a cocaine-induced heart attack. And so you had mentioned something, aortic dissection is what you see a lot with cocaine use. What is that exactly?
So aortic dissection, your aorta is the big vessel that carries blood directly from your heart to, it delivers, it has a big, looks like a candy cane. I don't know if you guys have ever seen the pictures of anatomy online, but it's just this big giant vessel that carries blood from your heart and delivers it to all of the other important systems in your body, your kidneys, your liver, your legs, even goes up to your brain. So when you use stimulants, cocaine, amphetamines, anything along those lines, you get this really big noradrenaline, norepinephrine surge in your body. So you get really high blood pressure, high heart rates. Because your blood pressure is so high, the volume of the blood coming out against your vessel, the aortic vessel, essentially causes it to not rupture completely, but the sides start pulling apart.
Like a balloon?
Like a kind of, but inside of the vessel itself. Like the inner lining pulls away from the outer lining, and we call that like a dissection. And a dissection, depending on the type, it's in a medical emergency with it. So,
and that'll induce a heart attack?
Well, that in itself won't necessarily. If it's closest to your heart, it can dissect over. But the heart attacks are usually caused, you'll have someone that came in from smoking crack or doing cocaine or something, or amphetamines along that line. They'll come in and be like, I have this crushing chest pain. I can't breathe. It's just not going away. And, that's why they seek help. The cocaine, the stimulants in itself causes vasospasm, right, in your coronary arteries. And when you have a vessel that's spasming like this, when it spasms close, there's no blood flow to your heart.
Oh.
Right? So it usually does this. And when it goes like this, lack of blood flow causes infarction, which is, death of heart tissue. That's what usually causes or can cause heart attack, right? Because of that spasm. If they have underlying heart disease, like atherosclerotic disease, it can cause a plaque to break off and induce a heart attack. So there's different mechanisms that can cause that.
All this heart attack stuff gives me anxiety. I don't like it, but I need to be more proactive with my heart health for Happy Heart Health Month of February.
What are you going to do for that?
Well, that's a good question. I'm not drinking anymore, so I guess work out, maybe a little bit of cardio, I get my steps in, stuff like that, do some more weight training. The Mind Pump guys wouldn't be too happy with my training regimen lately. Speaking of Mind Pump, Ben and I was on Mind Pump's podcast today.
How'd that go?
We weren't on their podcast as guests, but we were on their podcast on their live call-in show that they do. It was really good. Ben thinks we bombed it.
We had questions. Yeah.
Yeah, we had questions for them primarily on how to keep people in early recovery, what they have seen or what some of their suggestions would be on keeping people that are in early recovery from switching addictions, essentially.
Balance with working out, not taking it to an extreme. And they had some good suggestions too, I'll say that.
Yeah, so when that episode comes out, I'll clip it and, yeah, I think it'll be cool. And, drive people to Mind Pump's podcast like we do all the time, Ben.
Yep.
Yeah.
Facts.
So cocaine, obviously, it's a big heart issue. You shouldn't do cocaine. I know for myself, when I did cocaine, man, here's a good thing. Here's a good point to bring up. And I know for myself, I never did cocaine just by itself. If I wasn't drunk, I never did it. But if I was drunk and somebody said, hey, I have cocaine, okay, I'm in. When I would do the cocaine, it allowed me to drink so much more. And let me ask you this, and maybe you have the answer, maybe not. If not, we can research it. What I was told is that the reason when somebody does cocaine, they're able to drink a lot more is because your body is metabolizing the cocaine. It prioritizes the cocaine, And when the cocaine wears off, then it will move to the alcohol and start metabolizing that. Is that an accurate statement?
I don't think so.
Where'd you hear that, on the bar stool?
No.
No.
No, I don't know where I
Eating
heard
your
it from.
fried
I mean,
mushrooms?
if you think about metabolism of alcohol and cocaine and the mechanism of action and how fast it gets in your system, how fast it's broken down, they're very different. So,
Okay, well.
but
I
I
don't
do know
Sounded
one
right.
thing that we as physicians are usually quizzed on is that when you do both concurrently together, the way that the metabolism, like the metabolites of cocaine and alcohol, actually can bind together and prolong the excretion of the metabolites, and it causes it to stay in your system longer. So
Okay, so I was halfway right.
So
maybe.
like time release alcohol.
Yeah.
Cocaine.
Yeah. No, I don't know. That's just what I was told. So, all right, fine. All right, so moving on. The benzos is interesting because prior to this, you said benzos doesn't really have a huge effect on your heart.
in terms of like long-term data, right? I mean, if you're like, okay, benzos they calm you down. So it can decrease your heart rate, help decrease blood pressure. But when we think about heart health and benzos, it's more when you go through the withdrawal, because benzo withdrawal is very similar to alcohol withdrawal. So you get that sky high blood pressure, high heart rates. You can go into the DTs. You know, that's when you start getting in trouble with the benzos.
Okay. That makes sense. I experienced that for sure. Now, opiates.
Opiates, I would say obviously it's also a depressant. So, you know, it can decreases everything, your respiratory depression, your heart rates, blood pressure. But what we worry about, I would say, you know, high value topic would be IV drug use, whether that is with opiates or other substances, and causing endocarditis. Do you guys know what endocarditis is?
Infective endocarditis.
Yes.
Yeah.
We don't know what that is.
I have no idea. It's on the notes.
It's where when you inject, it's obviously not a sterile environment. So when you stick the needle in your vein, you get bacteria translocation, and then you can get a bloodstream infection. When you get bacteria in your bloodstream, your blood has to flow through your heart, right? And that certain bacteria have a propensity to seed on your heart valves, whether it's your aortic valve, tricuspid valve, mitral valve, you know, in your heart. And that in itself, if it's large enough, can cause heart failure. So you get young kids coming with florid heart failure, and you admit them, you work them up, and they have like huge bacterial vegetations on their heart valves. And then they some of them have to have a heart valve replacement.
What do you mean by vegetations? What's that mean?
So the bacteria essentially seeds the valve. So it attaches to the valve, doesn't let go, and it infects the valve. And then you start getting the vegetation, which is the bacteria, the pus, everything. It starts eroding your heart valve, essentially.
Oh, yikes.
And
God, I'm
then
lucky to be alive.
You are.
This episode's giving me anxiety.
Didn't you say you used to use toilet water?
Dude, no, yeah. So I did before.
Oh my gosh.
Well, I flushed it and like caught it at the same time, kind of thing. But,
Wait, what?
It was a 5-star restaurant.
You flushed the toilet and
Caught it. It was like a tankless one, so I had no choice but to put it in the bowl.
Wow.
Oh, that's interesting, because I was just going to ask you, why wouldn't you just take the top off the tank?
Yeah, because there was no tank. It was a commercial toilet. But anyway,
Did it touch the bowl, the needle?
probably.
Oh my gosh.
So yeah, not the proudest moment, but it brings me back. We're talking about what was it? Vegetative.
Endocarditis.
So I went to a detox once, and this was in Minnesota. It was on a third floor of a hospital. It was a lockdown. I was in there for 28 days, and there was a young lady that came in the same day that I did, and she was from up like northern Minnesota. So she was using well water to shoot up her oxys, I believe is what she was doing, but didn't cook it. I don't know, cooking it's supposed to kill the germs, but she wasn't doing that either. But anyway, that's probably not a fail-safe either. But regardless, she comes in and like half of her skull was cut out, so she was wearing this helmet, but that's what happened to her. She got so much bacteria from the well water in her system that like they even left her on opiates. And I was there 28 days in a detox, and she was still there when I left because they couldn't get this bacteria out of her or whatever the case was.
Yeah, what happens is when you get that bacteria on the valve itself, it starts shooting off bacteria, and the bacteria itself, they form blood clots around it and everything. We call it septic emboli, meaning portions of that endocarditis can break off the valve and travel through your aorta, and it can go to your brain, it can go to your lungs, it can go to any other part of your body. So it can cause infarctions, in your spleen, in your lower extremities, in your lungs, your brain. You can get an abscess, and the ramifications of it are very severe with it.
Yeah, well, that was the brain thing. And then people don't think about the indirect risk. This one I did to myself. Oh, scary stuff. I was really sick one day, and I remember I actually rode my bike 15 miles from my parents' house out there.
My neighbors.
Yeah, so Dr. T lives by my parents. But anyway, I had to ride from there to PGA, the Publix there, military and PGA, to meet up with my buddy, and I was really sick. It was a long bike ride, very long bike ride when you're dope sick. But I was in such a hurry to shoot my oxy that I didn't let it cool down in time. I boiled it up and shot the boiling water, and I felt it. I had never done that before. I had never thought that through. It was just always okay. But I must have been moving quicker than normal, not feeling well, and I literally felt it run up through my bicep. I could feel it hit my heart, and I didn't push it all the way in. I caught myself, but instant panic. I felt it in there, and I was like, "Oh my God, I'm gonna die!" But putting boiling water through your I could feel it run through my body,
veins.
and it scared the heck out of me.
Ugh,
But
no.
yeah, I mean, the indirect risks, too, of just living that lifestyle. I don't know, could you boil your heart? Probably. It probably wasn't good. Either maybe it cleaned it real well. I don't know.
It's yeah, maybe it knocked plaque off of your aortic arteries.
Yeah. Plus 5 years.
T, what do you do? Yeah,
That's a doctor's opinion on that.
Yeah, no. I mean, listen, you're going to have to deal with some of our antics.
I love it, though.
It's scary.
That
though.
is scary. That's scary.
I mean, you hear it's not, we're sitting here talking about the toilet water thing. That's not an abnormal thing.
No.
It's
It's pretty normal. I mean, people, if you don't have water, you're going to pull it out of a puddle, a pond, a canal. It doesn't matter.
I mean, but where do you go to not have water?
You find yourself in these situations. I don't know.
I guess that's why I'm so glad I'm a drunk, honestly, because some of the stories that I've heard, just that shooting boiling water on accident, no, thank you.
Yeah. And I mean, it's sad too, because we get these young kids in the hospital and you'll keep them there the treatment is it depends on what the scenario is, but it's either 6 weeks of IV antibiotics, and you don't want to send a drug addict home with access to their veins. So you keep them inpatient for 6 weeks, right?
Oh, yeah.
Or they need a heart valve replacement. And I've seen many of times down here, especially, where they've had the heart valve and that prosthetic valve that they had for, placed in lieu because of the original valve was destroyed. The surgeons are like, I'm not sure I want to do this. I don't want to replace another valve. And then what do you tell the patient? How do you have that conversation with them? The surgeon lost trust in you, and the only person that can save your life at this moment in time is the surgeon. So how are we going to convince them? What is our game plan going to be to convince that person to help you again? because this is the second time.
Wow.
You know, like it's tough.
Now, this just came. This could be a totally separate podcast, but I know we got to wrap up here soon. You know what? I'm gonna table that. I'm not even gonna bring that up. Okay, the last one, which I think is one that would oftentimes be overlooked, is K2 and spice.
Yeah.
And these are extremely readily available.
At the gas station.
Yeah.
Yeah.
So what do you see with that?
Mainly new onset strokes and very young kids who are just, you know, smoking spice, and they come in like an elderly patient with stroke symptoms and profound deficits that unfortunately don't ever go away.
Right.
It can increase their heart, you know, risk as well, but more so we've been seeing stroke in these patients, which is debilitating to them because loss of function of their arm, their leg, their eyesight, whatever it might be. You know, they think they're buying something quote unquote safe because it's at the gas station and it's legal, not understanding the ramifications of their decisions.
It says not for human consumption. If you look at I don't know if this is official history of spice, but it's my drug user history of spice. I got clean like right after spice came out, so I just smoked regular weed, but I was there to watch people. My friends were smoking it while I was in active addiction, and when spice first came out, it was very, very close to the THC molecule, which was the point. They were making a synthetic THC, but then every time the DEA would make that strain or compound, or what's the proper terminology?
Sure.
Yeah. Like illegal.
Yeah.
They would change one molecule so it would become legal, but over the course, and then they would make that one illegal and that one and that one. They keep changing the chemical just slightly to where over the course of time, spice actually got more dangerous because it got further and further away from the original THC mimicking chemical so that they could make it through these loopholes so they could be sold in the gas stations. So you watched like spice in the beginning was not as dangerous as it is today. And we watch that happen. Like they're trying to utilize law to make it safer. However, unfortunately, the con to it, they actually made it more dangerous because drug dealers are going to be drug dealers. People are going to figure out how to make money. So
I feel like spice too really just came on the scenes, what, about 10 years ago?
I want to say probably like 2008.
Yeah.
Is when I remember it popping up. I was still up in Minnesota. It was probably a couple years before I got sober.
Yeah. Nasty stuff, definitely. I think it caused people to have like psychotic breaks too, right?
Oh, yeah.
Oh, big time.
Yeah. I remember hearing a story about a kid that he had a psychotic break and like ate his it happened in Tequesta.
Really?
Oh yeah.
Yeah,
The
he
kid
like
ate somebody's face.
Yeah, he ate their face off.
That wasn't bath salts, like when that.
Maybe
guy
it
in
was bath
Miami?
It could have
I don't
been. Yeah,
know.
there was the Miami one too, but there was
Yeah.
one that happened in
But
Jupiter.
I mean, similar. You know, they get into a psychosis and things just go awry.
Man, I hope this episode's okay on YouTube. Talking about a lot of gruesome stuff. That's all right. I mean, you know, what's the worst that can happen? They demonetize me. We've made $36, guys.
Woo!
$36 on YouTube over the course of 7 years. Yeah. No, but it's fun. I enjoy doing the YouTube stuff. Is that it? I think that's
I
it.
think so. It's a good.
yeah, that was good. I learned some things. I'm gonna forget all those big words Dr. T just taught us.
Yeah, infective endocarditis, aortic dissections. Yeah. Those.
It is impressive. I was telling her this the other day. I'm like, you must have a good memory because I could not remember all this terminology.
So I want to just take a minute, and do you mind pulling your computer off here?
Oh yeah.
And I want to give Dr. T some credit. Okay.
gosh.
So
That's the ASAM?
no.
Whoa.
This book here, and if you're watching or if you're listening on podcast, I strongly encourage you to go and subscribe on YouTube. But the book that I'm holding is The ASAM Principles of Addiction Medicine. This book probably weighs 10 pounds.
It's like a mini fridge.
Yeah. I mean, this thing is heavy. And so this is the book that you had to study to become an addictionologist, right? Ben, you see all these little...
Really? That's just what's the rest of the medical stuff? Holy moly.
Oh yeah, that's just for addiction medicine. But it's like, I call it, it's like, I don't know. I obviously I had to remember a lot of things, but I still go in and read up on everything or topics daily just to stay present.
I think it might be cool just to share. I asked you like how you remember that. What'd you say the other day? You remember like keywords?
Yeah, there's like keywords that I use too.
Yeah.
I think we were talking about a medical entity with Steve, his ankling spondylitis, and I said bamboo spine.
Oh, yeah, that's right.
Or AFib and holiday heart.
Yeah.
That's how I like remember things, like key associations, I guess.
Interesting.
Like everyone finds their own little way of studying. Yeah.
Well, so this book, has all these little tabs in it. And, you obviously took the boards to become an addictionologist. And that's rather impressive. I mean, there's not a lot of addictionologists out there, I think we determined, right?
No.
So the fact that,
I would have quit as soon as they mailed me that book.
I know. That's crazy. What even makes you want to go into this?
What do you mean?
I mean, it's
so fascinating to me to learn about it, to read about it, and then to actually see it in person real time and apply it and help people. That's
great.
She's pretty much the coolest nerd I ever met.
Yeah. Yeah. She's studying her book on addiction medicine after she jumps out of helicopters and goes snowboarding.
Yeah.
You
Pretty
did that,
much.
a few weeks ago?
Yeah.
That's awesome.
You jumped out of a helicopter?
For
To snowboard?
snowboarding, yeah.
I didn't know that part.
Jackson Hole.
That's crazy.
Yeah. Wow.
All right. Well, that is it for this episode of Real Recovery Talk. Thank you for tuning in. In the end, if you have any comments, questions, or concerns, you can always reach us, info@realrecoverytalk.com. Again, that's info@realrecoverytalk.com. And ultimately, we want to help you turn your mess into your message. That is it. We will see y'all later.